Acid reflux disease is a condition where the reflux of stomach contents into the esophagus causes troublesome symptoms and even complications. Stomach juice contains a lot of aggressive forces, mainly acid and also digestive substances that help us with the breakdown of food. But putting them in the wrong spot definitely can result in heartburn and chest discomfort and make one's life miserable. Acid reflux disease, as we see it, is certainly influenced by a lot of the choices that we make as patients. And those choices are perhaps eating a little bit too much, eating too rich at the very end of the day, drinking too many cups of coffee, drinking too many glasses of wine. And we, of course, always want to encourage the right choices for our patients. It is time to seek medical attention when folks have reflux disease that is simply not controlled on their medications, over-the-counter medications or prescription drugs. If patients have had reflux symptoms for a long time and they're concerned about the safety of their medications or alternative options, either surgical options or medical options, and definitely seek medical attention when the folks have developed complications such as inadvertent weight loss, swallowing problems, problems with intestinal bleeding. Those are considered to be warning signs and they require urgent medical attention. The diagnosis always starts with our patient. One has to sit down, evaluate the patient, take a good history, look at any kind of factors that would contribute to the acid regurgitation, get a sense of the severity, get a sense for the treatment that has been done already to our patients. After that, we would start with an endoscopy, which is placing a tiny fiber optic instrument while the patient is asleep. This test allows us to assess the severity of the acid regurgitation. We can take pictures, we can even take a tiny tissue piece during this examination. After we have this initial evaluation done, we would sit down with our patients, go over treatment plan, including lifestyle changes as well as medical therapy. Newer therapies are constantly in development, and that includes, next to a very powerful medication, also surgical therapies and in the future perhaps less invasive treatment options.